skeleton is divided into two sections, an axial skeleton and an appendicular skeleton. Okay? Axial means your core. Appendicular means everything hanging off of that. Okay? In the human body, there's 206 separate bones. The axial skeleton consists of 80 bones. The appendicular skeleton consists of 126 bones. Okay? The axial skeleton is composed of bones on the central axis of the body. Okay? So the axial skeleton is your central portion, your head, your torso, and your pelvis. Okay? Everything in the center. Appendicular is everything that hangs off of that. Okay? The axial skeleton consists of your skull, the auditory ossicles, there's the little three bones in your ear, the hyoid bone, the vertebral column, and the thoracic cage. Okay, so everything in the head and neck area, your thoracics, and your vertebral column. The appendicular skeleton hangs off of it. Those are your limbs, your pectoral girdle, which is your shoulder and your arms, and your pelvic girdle, which is your pelvis and your legs. Okay. So axial is your core, appendicular is your limbs, your pectoral girdle, and your pelvic girdle. What does the axial skeleton do? Okay, the axial skeleton is a framework. It supports and protects your organs in the dorsal and ventral body cavities. Dorsal body cavity is your back. Ventral body cavity is your anterior part. It protects the special sense organs for taste, smell, hearing, balance, vision. All those located in your head and neck. Okay? That's what it protects. It provides attachment sites, okay, for the muscles that adjust the posture of your head and your neck, how you balance your head, how you keep your trunk balanced. It moves the thoracic cage for respiration, allows you to breathe. Okay? And it stabilizes the appendicular skeleton. So that's basically your core of what it does. Your axial skeleton is the inner portion, the core. Okay. This is the axial skeleton. Okay. You have your skull. Okay. You have the ribs in your thoracic cage. Okay. You have the lumbar section of the vertebrae, the sacrum, and the coccyx. Okay, that's the front view, and you also have the back view. And the sternum, we're going to talk about that in a little bit here. This is your breastbone that protects your thoracic cage. Okay. Cranial and facial subdivision of the skull. The skull consists of your face, the cranium, and associated bones with it. The face has 14 individual bones. The cranium has 8 individual bones. And there's 7 individual bones that are also associated with it. Right. And here's how they break down. So your face has 2 maxillas paired right and left sides, 2 palatine bones, 2 nasal bones, 2 inferior nasal conches, 2 zygomatic bones, 2 lacrimal bones, 1 vomer bone, which goes in the midline, and 1 mandible. Those are the 14 bones of your face. The cranium, part that surrounds your skull, your brain. You have 1 occipital bone, 2 parietal bones, 1 frontal bone, 2 temporal bones, 1 sphenoid bone, and 1 ethmoid bone. And we'll learn where all those bones are located, and we'll go through each one in detail. You got 7 associated bones. You got a hyoid bone, which is a free-floating bone underneath your mandible. It doesn't articulate with any other bone. And there's 3 auditory ossicles in the ear on the right and on the left. That makes up 6. Those are your malleus, your incus, and your stapes. And we'll go through each of those. So they're the smallest bones in the human body. Okay, the largest bone is your femur in your leg. Smallest ones are your auditory ossicles, the 3 of those. You have different structures that make up the back of the skull in the posterior view. The most posterior bone is your occipital bone. That's the bone in the very back of the skull. You have sutures where those 2 bones, where bones meet and connect together. There's a lambdoid suture, which is a suture between your occipital bone and the two parietal bones. You have a sagittal suture. I'll show you pictures in just a second. You have a sagittal suture, which is between the two parietal bones. You have an external occipital protuberance. So there's an outgrowth on the back of the occipital bone. It's about midway of the occipital bone, it just sticks out. That's your external occipital protuberance. And you got an occipital bone. The occipital bone is the most posterior bone of the skull. That's where vision occurs. That's where your lateral genetic nucleus feeds information to the back of the skull. That's your projector. When you see images, you see sights that's projected from the back of the skull by the occipital bone. Okay. Here's a picture of it. This is your sagittal suture. Your sagittal suture runs right between the right and left parietal bones. Okay, parietal bones are paired bones. That's where your sagittal suture runs. Your lambdoid suture is this suture line right here. Okay, that runs between the parietal bones and the occipital bone. Okay, so when bones are developing, these bones develop independently and then fuse together. Before they're completely fused, they record fontanelles, which are soft spots, like in the baby's skull. We saw a baby that skull to squish and deform so it can pass through the birth canal. It also is areas that are very dangerous for a child when they're developing until those sutures fuse all the way together, because it leaves a direct opening of soft tissue to the brain if anything hits it, any sharp, hard objects. Okay? So those are your sutures. Sagittal suture, your lambdoid suture. Then there's a squamous suture on the side. The squamous suture travels between your temporal bone, which is on the side, and your parietal bone. Okay? So you need to know the three sutures: sagittal suture, lambdoid suture, and squamous suture. Okay? You have the parietal bones, which are on the left and right sides of the skull. You have the sagittal suture, which is between the two parietal bones you talked about. We have the coronal suture. That's between your frontal bone. Let's look at the front of the skull now, not the back. So the coronal suture is between your frontal bone and the two parietal bones. And you got the frontal bone, which is the most anterior bone of the skull. Questions on your nursing exam and on my exams would be what's the most anterior bone of the skull? That's going to be your frontal bone. What's the most posterior bone of the skull? That's going to be your occipital bone. The anterior portion of the skull, the frontal bone, is where all your thinking process occurs, where your cerebral cortex is, where all your thought processes occur. The occipital bone is where visual images are shown, where you actually see and focus on visual images. Okay, this is the front part. So here's your frontal bone. This is the front part of the skull right there. So the coronal suture, the suture line right here, runs between your frontal bone and the two parietal bones. Okay? And like we said before, the sagittal suture runs between the two parietal bones, and the lambdoid suture runs between the occipital bone and the two parietal bones. Now you know all the major sutures of the brain, of your skull. Okay? Lateral view of the skull from the side. You see the frontal bone. Frontal bone is a single bone. Parietal bone, which is a paired bone, right and left. Occipital bone, which is a single bone. And the temporal bone, which is on the sides, and that's a paired bone, right and left. The temporal bone houses the external acoustic meatus, which is the opening to your ear. The mastoid process, which is your mastoid bone, which is just anterior to the external acoustic meatus. The zygomatic process, which is your cheekbone, and the styloid process, which is a hook that hangs down and connects the neck muscles. And we'll show you all these here. This is your side view. Okay. This is the parietal bone right here, right and left. This is a temporal bone, right and left. Those are paired bones. Okay. Your frontal bone is your anterior, it's a single bone, and your occipital bone. Again, frontal bone is the most anterior bone of the skull. Occipital bone is the most posterior bone of the skull. If you look right Okay, can I blow that? I can't blow that up. I didn't want to do that. Come back. Okay. If you look right here, you'll see a hook that hangs down from the skull. Okay? That hook is a styloid process. That's where your neck muscles attach to your skull. This opening here, this hole, is your external. You can't really see that one, can you? At least use green. This is your external acoustic meatus. That's the opening to the ear. And just behind that, this is a mastoid process we talked about. This whole section is your mastoid process. That's filled with hollow honeycomb-shaped airways to allow the skull to be light as possible. And we'll show you a cross-section view of that when we show you that. The other important parts is, this is your zygomatic arch. This is made up of your temporal bone and your zygomatic bone. It's called the zygomatic arch. When you get in a car accident or trauma to the side of the head, this is what breaks. This is the side bone. This is your cheekbone. When you have trauma to the side of your head, you're working in an ER, emergency room, and someone comes in and their eyeball is drooping. Look at where that bone is. That bone supports the lower rim and the side rim of the eye socket. It doesn't show up on green. Well, let's go back to red. Okay. If the zygomatic bone is broken, that pulls down. So when a patient comes in an emergency room and their eyeball is drooping downwards, you know they got a broken zygomatic arch. That's what causes it. It's one of the diagnostic things you'll look for in a patient. Okay. So we have that. We talked about that. We covered all those. And you see the same things on the axial skull too. Parietal bone, frontal bone, occipital bones back here, frontal bones up here. Your external acoustic meatus is your opening, mastoid. I don't see a styloid process on this one though. But we'll show you more of that as we go along. All right, any questions on that so far? Those are the basic bones on the side view of the skull. Sinuses, okay? Sinuses are really important because they create a lightweight structure for the skull. If the skull was solid bone, you'd have a lot of hard time balancing that. You have several different types of sinuses. A frontal sinus is right behind the nasal bone, and blockage can cause bacterial infection, sinusitis. We get a lot of patients that come in. Patients come in my office, in emergency rooms, and they'll have sinusitis. Sinusitis is extremely difficult to treat. Think about it. It's sinus, it's air, right? Can you get an antibiotic to an air socket? Not easily. So sinus infections are long-term, heavy-duty antibiotics. Keflex, 14 days, maybe 2 doses of it. It takes to treat sinus infections. They're not easy to treat. They take a long time. One of the key things you're going to look for as a nurse, as a physician, as a nurse practitioner, as a dentist, okay? Sinusitis changes when you change head position. It's hollow spaces. You lay back, it flows backwards. You lay forward, it flows forward. The intensity of the headache and the intensity of the pain varies upon your head position. Your patient will come and say, it gets more intense when I lay down. It's putting pressure on the back there of the skull. Okay, it gets better when I sit up. Okay, how many people have felt miserable laying down? You sit up, all of a sudden things start to feel a bit better because the sinuses put that pressure off the back now. Because things can move in air spaces. That's one of the diagnostic qualities of a sinus infection. You'll notice it changes with the position of the skull. Okay, and here's your sinuses. You have a frontal sinus, and this determines the type of headache you have. How many people have had a headache right above their eyes? Yeah, right between the top of the eyes. That's your frontal sinuses. That's where the infection is. Okay, you have a headache that affects your teeth. All the teeth on the left side hurt. All the teeth on the right side hurt when you shake your head. That's a maxillary sinus infection because it's putting pressure directly on the nerves of those maxillary teeth. Okay, the sphenoidal sinuses are just at the bridge of the nose, and right between the eyes are your ethmoid air cells. Okay, so looking at the sinuses, you know where the infection is depending on what the person is telling you. Okay, so those are all your paranasal sinuses. You got frontal sinuses, ethmoid air cells, sphenoidal sinuses, and maxillary sinuses. So bones of your cranium, the occipital bone we talked about is a single bone. It is the most posterior bone in the skull. I'm sorry. Inside the occipital bone, there's a foramen magnum, there's occipital condyles, there's a hypoglossal canal, and there's a condyloid foramen. Okay, foramen magnum. Foramen magnum. Foramen means what in anatomy? Hole, opening. Magnum means what? What's a magnum of champagne? It's a big bottle, right? So it means big hole. On the base of the skull, there's going to be a huge hole you can't miss. That's a foramen magnum. It literally means, in Latin, big hole. Okay, foramen means hole, magnum means huge. And it's the opening where the spinal cord travels from the skull into the vertebral column. That's where it passes through. It passes through the foramen magnum. The occipital condyles, that's where it articulates with the first cervical vertebrae. It's a condylar articulation. It allows motion. It allows the skull to move and rotate along the vertebral column. Your skull's not locked in place. It has these condyles, which allows it to rotate on. You can rotate yes, you rotate no. The hypoglossal canal is an opening. Again, a canal is an opening for the hypoglossal nerve that innervates your tongue. Anytime you see the word glossal, glossal is Latin for tongue. So as soon as you see glossal, you know it's going to innervate the tongue. The condyloid foramen is the center of the condyloid fossa that the skull rotates on. Okay, we'll get a picture here, and you'll see a little bit better. Okay, everybody see what I mean by foramen magnum? Can everybody see a big hole? Okay, so if I put that on the test, no one should miss foramen magnum. It's big hole. This is a foramen magnum. You're not going to miss it. That allows the spinal cord to travel and connects the brain to the rest of the body. The spinal cord travels through the foramen magnum, connecting the brain with your vertebral column. So there's your foramen magnum. You have your occipital condyles. This is your first cervical vertebrae. These are your condyles. This allows rotation around that spot of your skull. You have the hypoglossal canal, which is this little opening right here. Nerves are very small. It's a little opening right there. You have to rotate a bit more to see the space. It's not like our foramen magnum. It's not like a huge hole. And you have your condylar fossa. Fossa is a groove, or basically a space on the skull that allows another bone to come in and articulate, like your shoulder joint, is something that can roll in that area. So the condylar fossa and the occipital condyle are areas where it articulates and allows the skull to rotate in different directions. Hypoglossal canal is the canal, the opening for your hypoglossal nerve, which is the nerve to your tongue. And the foramen magnum is big hole. Okay, so far so good. Frontal bone, the most anterior bone as well. That's also a single bone. There's only one. It forms the superior ridge of the eye socket. Okay, there's a notch for the position of the ethmoid bone to fit inside of it. The ethmoid bone has a cribriform plate and a crystal galli. Cribriform plate just means a section of bone that has multiple tiny holes in it. What's that game you play with the little pegs? Cribbage? It's like a little cribbage board. It has little, I think I'm dating myself here. But it has a little board with all kinds of holes in it, all right? That's your cribriform plate. And the crystal galli is this middle section of it. The cribriform plate, all those little holes are for your olfactory nerve endings to run through. That's where they nerve through to get the impulse of smell to your brain. Okay? There's an internal ridge called your frontal crest, which is positioned just in front of or anterior to your cribriform plate. So here's the pictures of it. This is a frontal bone. So this is the front here. This is the anterior portion of your skull. This is the back. I can't spell back. All right. Everybody can still see the foramen magnum, right? There's no missing the foramen magnum. I said it like 5 times. Do you think it's going to be on the test? Don't miss it. It's the biggest hole there. All right, so this is your frontal bone. This is the ethmoid bone right here. And you can see, if you look at that real close, there's a middle bone in the section. That's your crista galli. And see all those little tiny holes. That's your cribriform plate. That's where all the nerve endings for your olfactory nerve that runs up through there. That's where you get smell from. All those nerve fibers that come from bulbs go through there. All these fibers run through there and run into the brain and interpret smell. That's what runs through this cribriform plate of the ethmoid bone. Okay, temporal bones. There's two temporal bones. There's a right and a left. They're paired. Okay, you have a squamous part of the temporal bone. Squamous just means what? Just like our tissue, squished, flat, right? Perfect. Flat, squished bone. It's a relatively flat bone of the skull. It makes up the lateral walls of the cranium. These sides here. This is your parietal bones. Okay. You have the mastoid process. It's your mastoid sinus. Like I said, the mastoid process sits just posterior to the external acoustic meatus. And it's made up of like a honeycomb appearance that gives light weight to the skull. It's an air sinus. You have the mandibular fossa of the temporal bone. That's where the mandible fits into the temporal bone. That allows your jaw to open and close. Allows you to chew, allows you to talk. Okay? And you have the styloid process. That's that big hook that hangs down. That's where neck muscles are attached. Okay, I'll get a picture in a second. Again, the temporal bone it also has the external acoustic meatus, which is the entrance to your ear canal. Has a zygomatic process. Remember, the zygomatic extends across your cheekbone. If a patient walks in and their eyeballs drooping down, it's a busted zygomatic bone. Any kind of injury, the first thing it's going to hit, baseball bat, pipe, car, whatever hits the side of your head, golf club, it's going to break the zygomatic bone. This is what sticks out the furthest. That's where it's going to hit, and that's where it's going to break. Zygomatic process, the temporal bone articulates with the zygomatic bone. That's your zygomatic arch. So when these two bones meet, your temporal bone and your zygomatic bone, that becomes your zygomatic arch, and that's what breaks. Okay. I know my writing's not real clear. My office, they don't let me have a pen or pencil in the office. I have to use a computer because my handwriting's too bad. Got to write things on computers. You have a petrous portion of temporal bone, which is inside the skull. It forms a ridge between the temporal bone and the occipital bone. Remember, occipital bone is the very back. The temporal bone houses the auditory sense organs. It allows you for hearing. The three auditory ossicles in each ear. Those are your auditory ossicles are three bones, the smallest bones in the human body. Okay, so this is a temporal bone. This is the squamous part. You can see it's flat, squished. Okay, it's a very flat bone. This is the opening for the ear, right here. This is your external acoustic meatus. Okay, and just distal to that, just posterior to it. Okay, that is the mastoid process. That has air cells that gives the bone some lightweight ability to it. Okay. This is the hook. A lot of times it's a little bit bigger than that. This is your styloid process. It comes down and it makes a little hook right here that attaches your neck muscles. This is the mandibular fossa. This is where the mandible fits into. So the mandible condylar process here fits into here and comes down here. Okay. This is your zygomatic arch. You can see how this sticks out. Okay. So any injury to the side of the head is going to cause a fractured zygomatic arch, cause the eyeball socket to droop down because that's your lateral and inferior border of your eye socket. Okay, if you look at the mandibular fossa again, this is where the mandible fits into it. Okay, there's a space between there so the mandible can move back and forth. What actually causes a concussion, football, baseball, whatever sport you're playing, rugby, hockey, okay? What causes a concussion is the mandible being slammed into the temporal bone. As this mandible is, because there's a space here. If you're hit in the jaw and it slams up, what actually causes a concussion is that bone slamming into the occipital space of that temporal bone. Okay? Because the brain, you gotta remember the brain's surrounded by liquid, it's surrounded by 3 layers. It moves. The only thing that's here is 2 movable parts, and when one bone slams another, that's what causes a concussion. They did a study at the University of Texas about 5 years ago, where we designed special mouth guards for all the football players. A mouth guard goes between the teeth and allows the teeth to hit and slide. It does not allow the mandible to slam into the temporal bone. When we put them on the team, there were 0 concussions that year for the entire football team. No concussions. Okay. I make mouth guards for all my athletes. Okay, motocross riders, guys know that play football, play rugby. I'm making one for my granddaughter that plays rugby. She always gets a tie-dye one with her Irish names team on it. It's the coolest mouth guard you'll ever see. But I always make mouth guards for her. What's that?
Can we get in on those mouth guards as well?
Oh, yeah. I can make mouth guards. They're not expensive at all. But anytime you play sport, you should wear one. Not only because it prevents concussions, it increases performance. They did a study with weightlifters. They could lift 2 to 3% more when wearing a mouth guard when opposed to not. Athletic ability is increased. Gymnastics, motocross, your athletic ability is increased. Because remember what you're doing. When that jaw clenches, what happens to all those muscles? Those bones come together. It's a lot of stress. Right. So what this does is it can't come together anymore. So when you put your teeth, they slide. So nothing's being transmitted to that muscles. What do they tell you to do when you're lifting? Relax your muscles, right? Relax your face. Don't tighten everything up. So when you tighten all the muscles up when something's going on, now they can't transmit that force up there. So you got more energy put towards your athletic sport. The mouth guards are really good. They're a really good investment. All right, you got that? This is what I wanted to show you. This is your mastoid process right here. See this? Look at all those air cells. Those are all hollow. That really decreases the weight of your skull. Okay? That's your mastoid process. Looks like little honeycombs inside of there. Okay? And again, it sits just posterior to your external acoustic meatus, opening of the ear. Okay. Bones that make up your face. That was the skull, the cranium. So what makes up your face is the maxilla, right and left. The palatine, your hard palate, roof of your mouth, right and left. Your nasal bones, right and left. Your inferior nasal concha. Okay, those you have an inferior, a middle, and an inferior, middle, and posterior nasal concha. Okay, you have a zygomatic bone, which is 2. You have a lacrimal bone on each side, and you have the vomer bone, which is single, and the mandible, which is single. Let me show you where all those are. This is looking at the front. So here's your frontal bone. Okay. If I look at this right here, what suture is that? I know it's not labeled, so I have to think it back. The suture runs between the 2 parietal bones.
Sagittal?
Perfect. Sagittal suture. That's your sagittal suture. That says sagittal, believe it or not. All right, then you got your parietal bones. Now look at the bones of the face. You have your, what do I want? Their palatine bone. Okay, you see this yellow bone right here? That makes up the hard palate of the roof of the mouth. That extends down. And you have your lacrimal bone, which comes to the side right here on the side of the nose. You have your zygomatic bone. Right? The nasal bone, which makes up the sides of the nose. Maxilla, this is all your maxilla right here. That's your upper jaw. Okay? The inferior nasal concha. You can see the nasal concha right here. You see the inferior nasal concha, the middle nasal concha, and you can't see the superior nasal concha yet. Okay? Remember the function of the nasal concha? They allow air to circulate when you breathe in and warm it up so cold air is not entering your body. And it also grabs stuff that's in the air, pollutants of that, and makes it stick to the mucus around that. Okay, those are the functions of the nasal concha. There's the bones that sit up there, and there's 3 of them. Your vomer bone is the single bone. It sits right in the center here. And then the mandible is this entire bone right here. That is a free moving bone. That's not attached. It articulates, but it's not, has no bony attachment to any other bone in the skull. Okay, it's a free moving bone. Okay. So the maxilla we'll talk about. That's the upper jaw up in here. That's your pair bone. There's the right and the left. Makes up the upper jaw. Contains the maxillary sinuses, which is above the back teeth, the anterior nasal spine, and the alveolar processes. The alveolar processes are the sockets the teeth fit in. That's your alveolar process. The palatine bone. The palatine bone is the roof of your mouth, the hard palate. You have a hard palate and a soft palate. If you put your tongue up there, You trace it back, about 2/3 of the way back, it'll get soft. So you have a hard palate, which is bony, then the soft palate, which is all soft tissue. That's your palatine bone. It's posterior to the palatine process of the maxilla, makes up 1/3 of the roof of the mouth. The other 2/3 is the soft palate. Okay, zygomatic bones, again, are on the side. They're paired bones, right and left, articulate with the maxilla and the zygomatic process of the temporal bone. That's what forms the zygomatic arch, where the zygomatic process of the temporal bone articulates with the maxilla. That's your zygomatic arch. Makes up the lateral walls and part of the inferior portion of your eye socket. Lacrimal bones. Lacrimal bones are right and left. They are the smallest bones of the skull. Remember, the ear bone bones are not part of the skull. The smallest bones of the skull. They're positioned on the medial aspect of the eye socket. So on your two eyes, the lacrimal bones are on the inside portions along the side of the nose. Okay, the lacrimal bones hold the lacrimal canal. Lacrimal canal connects your eyes to your nose, to the nasal foramen. Okay, they consist of this is our medial aspect, and it consists of the lacrimal foramen, which is the nasolacrimal canal, connects your nose to your eyes. So what happens when you cry? The tears are generated on the lateral glands. They sweep across your eyes to clear them, and then it drains through the lacrimal canal into your nose. That's why if you have a crying fit, what are you going to do? Your nose is going to what? Your nose is going to run. It's full of liquid. So all your tears and everything come through there, run through the lacrimal foramen, into the nasolacrimal canal, into the nose. That's just when you cry, your nose runs with tears. So all the tears drain, not all, but a lot of your tears drain into the nasal cavity. And that's through this nasolacrimal canal here, which is through the lacrimal foramen. Again, foramen just means hole or opening. And you can see it here. This is the ethmoid bone. This green one right here. The lacrimal bone is this red one right here. And you see this little opening right here, that little hole? That little hole is your nasolacrimal canal. And the lacrimal groove is the groove right above it. So tears flow from the outside portion, lateral portion of your eye, across the eye, into the nasolacrimal canal. The mandible. The mandible is not a right and left bone. It's a single bone. It makes up your lower jaw. It has a head, which is a mandibular condyle. The condyle is what articulates with the temporal fossa, with the fossa of the temporal bone. Okay? So it articulates with the mandibular fossa of the temporal bone. When it slams into that, that's what causes our concussions. You have a mandibular notch, and you have a coronoid process. You need to know both those things. And we'll show you in the picture what those are in just a second. We also have a ramus, an angle, and a body. The body is the alveolar process. We have two sockets. The mental foramen is an opening for passage of nerves. And the mental protuberance is the anterior edge that we use to line up, like we do brace and orthodontics. We do a side view to line that up to get a correct jaw position. Okay, so here's the mandible. This is the condyle. Okay, that's what articulates with the mandibular fossa of the temporal canal. This is what fits up into the fossa. So when you have a traumatic injury that comes up, that's what slams into the fossa. That's where the jaw rotates. It's like a ball and socket. Okay, that's your condylar process. If you have a patient come in, car accident, where they hit the anterior portion of their jaw, okay, where the front of the face has been struck, baseball bat, golf club, car accident, where you hit the dashboard, the first thing you're going to look for is a fracture on this condyle or on that condyle. Okay, because you got to remember, it fits in this opening like this. If it's being slammed backwards, this direction from frontal trauma, it's going to go this direction and it's going to snap. That's where you want to look on your x-rays, because a lot of times you can miss those fractures, and those are important fractures to treat. Okay, so that's where you're going to look. With that difficult in the jaw, there's a possibility of a condylar fracture. That's direct facial trauma. Side trauma, you can look at the zygomatic arch. Direct facial trauma, you can look right for the coronoid, the condylar process, fractured condyles. Okay? So there's your condyle. That's what fits up there. This is your notch. Let's use purple. Purple. This area right here. This is your mandibular notch. Okay. This is the coronoid process. So you have your condylar process, your mandibular notch, and your coronoid process. Those are all the three areas up in the top part there of it. The ramus of the mandible. This is your ramus right here. The part that goes up. This is the angle where the mandibular forms an angle. That's the angle of the mandible. As the angle goes up, that's the ramus. As the angle goes across, this is the body. Okay, so we've got the coronoid process. We got the mylohyoid coronoid process, the mandibular notch, and the condylar process. You've got the ramus, you got the angle, and you got the body. The body of the mandible holds the alveolar processes. That's what all these teeth fit into. Those are alveolar processes. That's the body of the mandible. You have your mental protuberance. The mental protuberance is the most anterior section or portion of the mandible. Again, we use that in side x-rays, lateral views, to line up broken jaws for orthodontics, to make sure everything lines up. We line up that mental protuberance.
That's what people shave off when they want their chin smaller.
That's right. Yep. When they do shin reductions, that's what they shave off.
Here's a question
Exactly.
that might be off topic a little bit, but what causes mandibular tori?
It's not a pathological problem, so nothing causes it. It's usually find it in 15 to 20% of the population. The only time it's not a cause, it's just a normal bone growth. Everybody has to some extent, but no one, a lot of people have them bigger than others.
I was
Pardon?
Oh, I was looking at pictures of my orthodontist and I saw some of them that were really big and others.
Some are huge.
Tiny.
And it's not pathology, it's just normal bone growth. There's no cause to it, just you're part of your genetics. And they don't cause any problems until you lose teeth and have to put a denture in. You put a denture in, you cannot put it over mandibular tori. Then you get to cut them off. Cutting off tori is extremely painful procedure. It's all you get the patient numb and you take a diamond burr and you just cut through the bone, through the gum, and just shave it off. And the healing is very painful, but it's the only way to do it. You just got to cut the bone off. You can get them on the palate, the roof of your mouth also. And like I said, they're not pathologic in any way. The only time we remove them is when we want to do dentures, or if they get so big, they trap food underneath and cause infections to fester underneath. Then we cut them out. Those are the only two reasons we usually cut them out. But they don't cause any harm. They're not a disease process. They're not caused by anything you did, any environmental factor.
I just thought it was
genetic
interesting.
growth of normal bone. That's a good question. And you can get some really funny shaped ones too. I'll bring in some pictures if I remember. All right, so we got all that. Only thing I want to mention is there's a mylohyoid line, which is right here on the inside of the mandible. This is where your mylohyoid muscle attaches to the mandible. And this little guy right here, this opening, that's a foramen. It's called your mental foramen. There have been a lot of root canals done because of that little guy when they don't have to be done. Remember, when a tooth gets infected, it shows a black spot where the bone has been infected on the x-ray. Now, look at the mandible and pretend you're shooting an x-ray right here in this direction. The x-ray passes through here. It hits that little space. That space means it's going to be a black spot on the x-ray, right? Because there's no bone there. So when you get your x-ray back and you look at it, there's a black spot. If that lines up, usually with this second bicuspid right here, if it lines up right on the tip of that bicuspid root, a lot of dentists go, oh, abscess, root canal, and they do root canals. I've seen hundreds of root canals on perfectly good second bicuspids because they thought the mental foramen was an abscess. And you know the way to prevent that? Take the second x-ray and angle it from here. If the dot moves, it's the middle fragment. If it doesn't move, it's part of the tooth. Real simple solution. Just change the angle of it. Because if you change the angle, it's going to hit that hole at a different portion coming through, and the hole is going to be in a different spot. If it's affection on the tooth, it's not going to change. It's part of the tooth. So, logical thinking sometimes saves patients some work. All right, the infant skull. When we talked about the skull, we talked about those areas with the sutures. Every one of those sutures is where bone has formed and then grown together. In the infant skull, you have 4 major fontanelle areas. A fontanelle is an area where the sutures, where the bones have not ossified and come together. So they're membranous areas where sutures will eventually form. Suture is bone. It's going to be very difficult to break into that. Okay, but as yet, the infant, they have these holes or these spaces called fontanelles, and there's 4 of them. Okay, it's very important during childbirth. If that skull was completely formed before childbirth, it would never fit through the birth canal. It's not going to make it. Babies' heads are huge. It's hard enough giving birth with the ability of the skull to collapse. Okay? So it allows for distortion of the skull during childbirth. The soft spot is a big one in the front. This is the main one that everybody talks about. This is your anterior fontanelle. That's what's called your soft spot. There's 4 of them. The one that's called the soft spot is the anterior fontanelle. There's an anterior fontanelle, a posterior fontanelle, a sphenoidal fontanelle, and a mastoid fontanelle. Those are just areas where the bones have not fused together, so there's membranes there, and things can puncture into the baby's brain directly. The brain's not protected all the way yet. Okay? Get done with that. So there's your fontanelles. This is your anterior fontanelle. This is the one in the front. This is the main area. You can see the baby falls on something. They fall towards the front of their skull. And if there's a sharp object or point, it's going to penetrate directly into the brain. That is not covered yet. Okay, so there is your anterior fontanelle. Looking on the top, again, this is your anterior fontanelle. This is your posterior fontanelle. Okay, on the side, this is your sphenoid fontanelle. Where am I at? Here's my side right here. Here's your sphenoid fontanelle, and here's your mastoid fontanelle. Sphenoid by the sphenoid bone, mastoid by the mastoid bone. Then you got an anterior in the top and posterior in the top. So those are the 4 fontanelles that allows the skull to actually compress or deform to go through the birth canal. Okay, until those have covered over with bones, the child is susceptible to brain damage. Anything that's sharp or can punch you, just your skin, can go right into the brain. Okay, that's the danger of it. The adult vertebral column, okay, is made up of 26 bones, your vertebral column. You have 24 vertebrae, 1 sacrum, and 1 coccyx. The 24 vertebrae, you have 7 cervical vertebrae, which is C1 through C7. You have 12 thoracic vertebrae, which is T1 through T12. And you have 5 lumbar vertebrae, which is L1 to L5. That makes it 24. And then there's 5 of them that are fused to make 1 sacrum. And then we have 3 to 5 that fuse to make up the coccyx, which is your tailbone. Okay, so C1 to C7, T1 to T12, L1 to L5, then your sacrum, then your coccyx. That's 26 bones that make up your vertebral column. Okay, the anatomy of it. What the function of the vertebral column does is to enclose and protect the spinal cord. Okay, it supports the skull. It balances your skull on your body, so you can walk, so you can move, so you can sit, so you don't have to sit and hold your head up all the time. It balances it on there for you. You balance on the vertebral column. Supports the weight of the head, the neck, and your trunk. Transfers weight to the lower limbs. So as you walk, the balance and weight of your entire trunk, head, and neck area is being transferred to your legs. That's where your leg muscles, your legs are so much larger than your arms, because all the weight and all the mass, everything is transferred to those legs, to the lower limbs. And it helps maintain the upright position of your body. The spinal cord. The spinal cord has 4 major curves called spinal curves. Okay. There's a cervical curve, a thoracic curve, a lumbar curve, and there's a sacral curve. Okay. Those are all curves that match the vertebral column. Your cervical vertebrae, thoracic vertebrae, lumbar, and sacral. These curves with the muscle attachments to them help maintain your balance. Okay. If your vertebral column was straight up and down, you couldn't maintain balance. You know how you shift and you move. So the curvature of your spine of your vertebral column allows you to, when you start drifting one way, to compensate for that very easily. It lets you maintain your balance while you're walking, while you're moving, while you're standing. Okay, and you can see this is your spinal curves. There's 4 main curves. This is your cervical curve. Okay, this is your thoracic curve. This is your lumbar curve, and this is your sacral curve. Okay, you see all the curves equalize each other out. So when the body shifts to one direction, the curves help to balance you out, so you can walk, so you can move, so you can keep your body balanced at all times. Those are the functions of 4 vertebral curves, 4 spinal curves. Okay, you can have abnormal curvatures of the vertebral column. You can have scoliosis, which is a lateral curvature, where instead of the spine being up and down, it curves to the sides. You can have kyphosis, which is an exaggerated posterior curve, like a hunchback, okay, in the thoracic region, or lordosis, which is exaggerated anterior curve in the lumbar region. Okay, these are examples of those 3. You can have kyphosis, which is your posterior curve, scoliosis, which is your lateral. You can see where this is displaced. The curve goes laterally rather than up, straight up and down. And lordosis, where it goes towards the front. Kyphosis goes towards the back. Okay. Actually, I should have put this one right over here. This curve goes more anterior, and this goes posterior here. And scoliosis goes laterally. Okay. Those are 3 different diseases or conditions of spinal curvatures that is abnormal, making it difficult to walk and balance yourself. Okay, so the spinal curve, the developing infant. You ever watch a baby try to walk? What happens? They'll take a step, and if there's nothing to hold on to, what do? They tip over. Their spinal curve, the spinal cord, the vertebral column, has not developed curves yet. So it's a straight up and down motion. So as they try to walk, once they shift to one way, there's no curve to balance that. So they keep going, and completely fall over. Okay? So once the curves are developed, then that's why they can't walk until 9 months to a year and a half, somewhere in that range. They don't have the curvature of their vertebral column yet to balance their movements. Okay? They lack proper curvature, and they lack muscle coordination to control that. Okay? You can see that at the fetal onset of the newborn, you can see how straight the spinal cord is and how difficult it's going to be for that baby to balance. And you see by the time you're adult, you can see the natural curves. So if something shifts one way, you can come back the other way because everything's curved. Everything's balanced in a reciprocating motion. Okay? So we shouldn't walk and fall over. You shouldn't, but unless you're drinking a lot, then the curves don't matter. Okay? Vertebral body. So your vertebral column is made up of all these little vertebrae. Okay? These are called vertebral bodies. They support the weight along the axis of the body, going up and down. They have an anterior structure. The vertebral body is separated from every other vertebral body by what's called an intervertebral disc. This is what ruptures when you have a herniated disc. Okay? It is not filled with any fluid. It's not filled with water. It's not filled with any kind of fluid in the body, like your shoulder, your knees. Those have synovial joints. Those have synovial fluid, allows in a free range of motion. Vertebral discs are separated what's called by a pad of cartilage called an intervertebral disc. It's just a pad of cartilage. So here's your bone, in between that bone, there's cartilage. Cartilage allows some compression, like when you jump, when you run, so you don't compress bone on bone. Okay? If you have a herniated disc, that cartilage is damaged or destroyed, and now you have bone on bone compression. That hurts. That's what causes pain. So that's an intervertebral disc, and it's a pad of cartilage. And you need to know that for nursing exams and for my exams. Okay? It's an intervertebral disc. There's no fluid, no blood supply. It's a pad of cartilage. Okay? Remember, cartilage is avascular. Okay? So all it is a means to separate the two vertebrae so they don't compress into one another. Okay, you have a vertebral arch, which forms a vertebral foramen. Foramen means opening. So as this vertebrae arches, it forms a foramen. It's made of a pedicle and a lamina. The spinous process of the vertebrae projects or points posteriorly, points out the back. The transverse processes point laterally to the sides. We'll talk a little bit about spinal bifida. Spinal bifida is a malformation of structures that make up the vertebral arch. The vertebral arch goes over and forms a foramen. That foramen is the spinal cord going through it. That's to allow the spinal cord to travel through the body and then branch out. Spinal bifida is a disruption of that tube where the nerves of the spinal cord actually come outside and out to the outside surface of the body. We'll show you some pictures of that and exactly what that means. But this is what it looks like. These are your intervertebral discs, these purple things right here. Those are cartilaginous pads. That's all it is. Okay? Your transverse processes point laterally. Where's the other one? Your spinal processes point posteriorly. So the spinal process points directly back, posterior. The transverse processes point laterally to it. Here's your arch. This forms an arch here. And this arch, as they come together, forms a canal. That canal allows the vertebral column, the spinal column, to pass through it. Okay? And it forms what's called an intervertebral foramen, an intervertebral opening. Okay? So these are your vertebral bodies, and they form an arch. Here's your arch. When the next one lines up, it forms a foramen. Spinal cord passes through that foramen. Transverse process go lateral, spinous process go posterior. Between them is a intervertebral disc. That disc does not have fluid, does not have blood vessels, does not have nerves in it. It is just a pad of cartilage that prevents the squishing of those bones together. Okay? A herniated disc means those cartilage pads have been either displaced or completely gone, and then we have bone-to-bone contact, which causes pain. Spinal bifida, we talked about a little bit. Spinal bifida is a birth defect. It's a neural tube defect. It occurs when a baby's spinal cord fails to develop or close properly within the while in the womb. So the spinal cord is not closed completely by the arch of the the vertebrae. Symptoms we've seen on the skin above the spinal defect, they include like an abnormal tuft of hair, birthmark, protruding spinal cord tissue. It can be from a minor little tuft of hair to a major puff of spinal nerves outside the cord. Okay? When treatment is necessary, it's done through surgery to close the defect. Remember, it's not something you can just cut off. That's your spinal cord. That's outside the vertebral column right now. Okay? And then you manage the complications of it. And that's a severe case of it. Okay? That baby can never walk. The spinal, those are all the nerves from the spinal cord on the outside of the body. You can't just take something like that off. Okay? That requires major surgery and patching together and just treat it symptomatically. But the tube, the spinal cord that runs here, all these nerves that usually travel down now come outside the body. Okay? There's a defect in the tube itself where the spinal canal, the nerves actually go outside the canal and start to exit the body. All right, vertebral column still. You have articular processes. Well, they line up to form an arch and they form the canals, the foramen. You have processes that line up on. You have a superior articular surface and an inferior articular surface. So these two surfaces come together from different vertebrae. One forms this arch and the other forms this arch. This is your superior, this is your inferior. Okay? So these articulations, these vertebral bodies are separated, we said, by the intervertebral disc. When they come together, this creates an intervertebral foramen. Through this foramen is where your central nervous system passes. Your spinal canal. Okay. And you can see it. You can see when they form. Here's your inferior process. Let's see if this one's labeled here. This is the inferior process right here, and this is the superior process, and it forms a vertebral canal. This is the inferior, and then there's a cartilaginous pad in between each one, so when they hit up again, it's not bone hitting bone. So you have these articular facets, okay, where they can hit up against each other. So again, so you're not bone to bone. Okay, we talked about the different regions. The cervical region is C1 through C7. Thoracic region is T1 through T12. Lumbar region is L1 through L5. Then you got the sacral region and the coccyx. Sacral region is 5 fused vertebrae. Coccyx is anywhere from 3 to 5 fused vertebrae. So those are your columns. All right, these are your spinal curves. You can see your cervical curve, your thoracic curve, your lumbar curve, and your sacral curve. And again, you can see how when you start to move and your body shifts one to another, those curves allow your body to balance itself and correct itself. Okay, seven cervical vertebrae. They support the weight of the head, Spinal process are bifid, means there's 2 of them, except for C7, and they all have a transverse foramen. Remember, the transverse foramen point where? They point laterally. Okay. What's the other process? Now I'm drawing a blank on it. The other process points posteriorly, the transverse point laterally. Okay. They all have transverse foramen. And there's 2 cervical vertebrae that have specific names. You need to know these. C1 is the atlas. C2 is the axis. Okay. So the first cervical vertebrae is called the atlas. The second cervical vertebrae is called the axis. And they allow different functions because of their shapes. C1, this is called the atlas. Articulates with the occipital condyles of the skull. Makes direct condyles, and those occipital condyles we looked at, okay, on the occipital bone of the skull. Does not have a body, just has this disc. Okay, has the largest vertebral foramen of all the vertebrae, which makes sense. That's where the spinal cord comes down in the largest part, because it gets smaller and narrow as it goes down. So the largest opening of any vertebrae, okay, is your atlas. It allows the head to move up and down. It allows you to say yes. That's what the atlas does. Allows the head to move up and down direction. The axis, C2, has what's called a dens. A dens is a growth or an extra bone coming off. It has a transverse ligament that binds to this growth or this dens and allows the heads to move side to side. Allows you to pull it across side to side. Okay? So if you move your head in a yes direction, that's the atlas moving. If you move your head in a no manner, that's the axis moving. Okay. There's 12 thoracic vertebrae. All have rib articulation points. Okay. So every thoracic vertebrae has a rib attached to it. All 12. Of the spinous processes point inferiorly. That was what I was trying to think was spinous process. Okay, so most spinous processes point inferiorly on the thoracic vertebrae. The lumbar vertebrae, again, there's 5 of them. They support the weight of the torso. The vertebral bodies are the largest because they're supporting the entire weight of your torso. So the vertebral bodies are very large, and their spinous processes point posterior. Transverse processes point lateral. The spinous processes point posterior. So these are your large vertebral bodies, your lumbar vertebrae. And there's 5 of those. The sacrum, remember, sacrum is 5 vertebrae that are fused together to make 1 bone. So there's 1 sacrum, but it's 5 fused vertebrae. Okay. There's structures in the sacrum. You have a sacral hiatus. You have a medium sacral crest. You have an entrance to the sacral canal, and you have a sacral foramina. Okay. And there's a different thing. The sacral foramina are the openings or the holes. Their foramens are just holes. Okay, here's your sacral curve we talked about and help balancing the body. This is the median sacral crest. Okay, that's towards the midline. This is the lateral sacral crest. So again, here's your median sacral crest right here. And this is your lateral sacral crest, where like a hilltop. Median just means in the midline, lateral to the sides. Okay, this is the entrance to the sacral canal, right on the top. Okay. The coccyx. The coccyx varies from person to person. It either has 3 or 5 vertebrae and they're fused together. The adult male coccyx points anteriorly. The female coccyx points inferiorly. Okay, the coccyx consists of the coccygeal cornu, which is the extension of the bone on the ends of it. Think about it. Why does the male coccyx point toward the front and the female coccyx point inferior towards the back?
Female have childbirth.
Perfect. Perfect. If the coccyx on your tailbone is pointing to the front of your body, what's that baby going to hit when it comes down the birth canal? It's going to hit right in that bone and cut everything. Okay? So the female, the bone is actually bent backwards and points inferiorly, points down, whereas the males point anteriorly towards the front. For simple reason of childbirth. Okay, and here's your coccyx here. This is your 3 to 5 bones that are fused. And here's the cornu, which is your bony extension on the ends of the coccyx. All right, the thoracic cage, 12 thoracic vertebrae. It protects your heart, your lungs, your thymus, and other structures of the thoracic cavity. It serves as an attachment site for muscles during respiration, positioning your vertebral column, and movements of the pectoral girdle and the upper limb. So all that is involved in your thoracic cage. Respiration, positioning your vertebral column, and movements of the pectoral girdle on your upper limb, your shoulder joint. Okay, rib classifications. This is the old classification. We don't use this anymore. You may, oops, I shouldn't have said that. Hold on. Don't use these terms anymore. You may see them in some old journals, but I'm not going to hold you responsible for those. The ones we're going to talk about are true ribs, false ribs, and floating ribs. Those are the 3 you need to know. Those are the new nomenclature. It's the same thing, it's a different name. But this is the ones that we use now. True ribs are ribs 1 through 7. False ribs are ribs 8 through 12. Free floating ribs are ribs 11 and 12. Okay, that's the definitions you need to know, and I'll show you why. I mean, they're called true ribs. This is not because they don't lie. Okay, it's because how they're connected to the sternum. Okay, here's your sternum. We haven't talked about the sternum yet, but we will. This is your sternum. This is where the breastbone and your breastplate is. This is what supports your thoracic cavity. That's the anterior portion. That's what protects everything from frontal trauma. Okay, these are your true ribs, 1 through 7. If you look at the ribs, they all come back from thoracic vertebrae, and they wrap around, and they wrap around, and they wrap around. Every single rib through 7 connects directly to the sternum. Look at each one. You can see each one has an individual connection to the sternum. Those are true ribs. They're connected to thoracic vertebrae, wrap around your back, and they directly connect to the sternum. Your false ribs do not directly connect to the sternum. Here's rib 8. Comes around from the back, wraps around, and it connects to this rib right here. It does not have a connection to the sternum. That doesn't exist. Okay, so true ribs are ribs that connect directly to the sternum, ribs 1 through 7. False ribs are ribs that do not connect directly to the sternum, ribs 8 through 12. Okay, free floating ribs are ribs that don't connect to anything except the thoracic vertebrae. They connect there and then they don't connect. They're free floating in space. And we'll show you an example of those in another one of the pictures. Does that make sense, everybody? So true ribs, false ribs, floating ribs. Those are the ones we want you to remember. Those are the new terminology. And all it deals with correctly the sternum. So the ribs, there's 12 pairs of ribs. Each rib articulates with a thoracic vertebrae. Thoracic vertebrae are numbered 1 through 12. There's your 12 ribs. Each vertebrae has a rib attached to it. The structure of the rib, every rib has a head, a neck, a tubercle, an angle, a costal groove, and a body. If you look at the rib, this is the body. This is the main portion of your rib. Okay? You have a tubercle, which is a growth. You have a head, and you have a neck. Right up there. And then just like the man, we have an angle. And you have a groove in here where the blood vessels and nerves run called the costal groove. And that's the rib. That's what makes up a rib. Okay. Thoracic cage. Okay, the thoracic cage is your ribs, and it comes across and meets in the sternum. The sternum consists of the manubrium, the body, the xiphoid process, and the jugular notch. Okay, those are the four parts of your sternum: manubrium, body, xiphoid process, and jugular notch. And each are important. This is the manubrium. The manubrium is this plate right here, this circular plate. That's your manubrium. The jugular notch is the groove in the most anterior, the most caudal or portion towards the skull that you have. The body is the main portion here, and the xiphoid process is this notch or growth, not a notch, but a growth of bone right down the end. So those are the four things you need to know. You need to know the manubrium, which is the plate, the body, which is the entire sternum, the xiphoid process, which is the end of it, and then the jugular notch, which is the most anterior portion of the sternum. Now, if you look at take a good look at it. Look at the xiphoid process. It sticks below the ribs. Okay. How many people here know CPR? Okay,
A little bit.
yeah. You know, there's different hand positions for a child or an infant and an adult. Adult, you go 2 fingers, you go over the main part, and you compress right here. A child, an infant, you do not do that. If you did that on an infant, you will kill them. You will kill it because of the xiphoid process. You got to remember how an infant develops. The infant has a huge liver compared to the rest of the body because the organs develop, but the bones haven't yet. If you did CPR on an infant and you push on that xiphoid process, okay, it would go right through the liver and completely lacerate it every time. You can see how sharp that little bit. It's a piece of, I'm pointing like you can see me pointing. You can't see me pointing. This xiphoid process right here, okay, would lacerate their liver. That's why in an infant, they tell you 2 fingers and they tell you mid-nipple line. You don't ever go below the mid-nipple line in an infant because of the xiphoid process and because the liver are enlarged disproportionately on an infant, and it would just completely destroy their liver. That's the reason they do it that way with CPR. An adult, if you press on it, it may break the xiphoid process, you may break ribs. That's part of doing CPR. Okay, but an infant, you always go higher so you don't get that xiphoid process into the liver. Okay, so 4 structures: the jugular notch, manubrium, body, xiphoid process make up the sternum. All right, who's paying attention? Number 1 is what? What bone?
Right parietal?
Oral?
Okay, right or left?
Right. Or left. Yeah, left. Good.
Okay, look, good. Look at how you're looking at it.
The back end.
Right. Number 3, this bone here. This is the most posterior bone. So you're looking at the back. The mandible coming up front. You're looking at the back because of this bone right here. We'll go to that in a second. So this is the left parietal bone. Number 2 is the
Right.
Right.
right parietal bone. And number 3 is what?
Occipital.
Occipital. That's occipital. That's how you know you're looking at the back, because of the occipital bone. The occipital bone is the most posterior bone of the skull. If you see the occipital bone, you know you're looking at the back of the skull. Okay, that's between the left and right. Okay, and same thing on the skull on the side. You have the left parietal bone, right parietal bone, and you have the occipital bone. All right, what's that suture, that line running between the 2 parietal bones? What suture was it?
Sagittal.
Perfect. Sagittal suture. What's the suture between the occipital bone and the parietal bones?
Coronal.
Not coronal. Someone
Lamboid.
said it.
Lambdoid.
Lambdoid suture. Perfect. What's the suture between the temporal bone
Squamous.
and the parietal bone?
Squamous.
Squamous suture. Perfect. Yeah, squamous suture. And then what's that pointing at? What bone is that pointing at?
Temporal bone.
Perfect. Perfect. Temporal bone. And this one's pointing at the,
Mastoid process.
yeah, it's kind of hard to see. It's hard to see, but it's pointing to this right tip right here, which is a mastoid process. Okay, and the other one's pointing to this hook that hangs down right below that, which is what?
Styloid
Styloid.
process.
Styloid. And what connects to the styloid process? What's the function of it?
Next to the neck, right?
Perfect. Perfect. Connects to neck muscles. Good. Okay, like occipital bone has a protuberance in the back called what?
Occipital condyle.
Or actually, that's pointing. That's not pointing to it. What's it pointing to? I can't. It looks like it's pointing to the hard palate. I can't see. Occipital condyle. Those are the rotational points. You can't really see it that well, but it's occipital condyles where the occipital condyles connect with which vertebrae? The axis or the atlas?
Beans from Brazil, Shelteeta from Jersey. Where's the Tennessee?
Yeah, Atlas.
Most of it's
Which ones do the occipital condyles of the occipital bone connect to? Axis or atlas?
Atlas.
Atlas. Perfect.
Atlas. Yeah.
Atlas. And that allows what kind of motion?
Yes.
Up and down.
Allows yes motion up and down. Perfect. All right. And this one's pointing to what? The next one below that.
Occipital.
The protuberance.
Yep, occipital protuberance right there. External occipital protuberance. And then this is pointing to, what bone is this?
Where?
Which one are we talking? Mandible?
Mandible. That's your mandible.
Ah.
Good. You guys actually paid attention. All right, let's do this one here. Whoa, come back. All right, where am I starting at? Oh, number one. What's number one? I didn't see number one. Number one's right here. What's that bone?
They got
Mandible?
Mandible. Or this, the body of the mandible, remember? Yeah, different section. That's the body of the mandible. All right, and this is pointing to what processes that hold the teeth in place?
The alveolar part.
Alveolar process. Okay. Then I think we go down. I assume we go this way. So what's this pointing to?
The mental protuberance?
Mental protuberance. That's what we like. We said. We said we shave it off. We're doing a chin reconstruction. That's your point of your chin. Okay. What's that big dark hole that people mistake for an abscess all the time?
The mental foramen.
Mental foramen. Perfect. Okay. And what part of the mandible is next?
The
Angle?
Angle of the mandible. And then this part of the mandible is called the what?
Ramus?
Ramus. And this is called the
Mandibular notch?
mandibular notch. And this is called the
Condylar process.
condyle process of the condyle. Yep. And this is called the
I don't know. Process.
Coronoid process?
coronoid process. Perfect. And if you have a frontal trauma to a patient, they get hit directly in the front of the face, auto accident, what's the bone you're going to look at that's going to fracture? Which part of the mandible do you look at?
Leo. Do you know what I found this morning, Leo? That's a tough.
You look at the condylar process. You look at the condyle right here. Because this is the only part that sits in a bone. It sits in the fossa of the temporal bone. And if there's an accident and it gets forced, the face gets forced backwards, it's going to force against this bone. And the skull is not going to give. The condyle is going to give, and it's going to crack. And that's where you look for a fracture. If you have frontal face injuries, any kind of ER. And this line right here is called the what?
Mylohyoid line.
Perfect. Mylohyoid. Okay, mylohyoid line. And what connects to it?
The thing.
That's a trick question. The mylohyoid muscle. The mylohyoid muscle connects to the mylohyoid line. Okay, and these are what?
Teeth.
Teeth. Nobody's finished that one, especially in my class. All right. Oh, there's one more. What's this part? No, it's this part of the condyle. What's it called?
Head.
Head.
It's called the head. Yeah. It's called the head of the condylar process, the top part.